You are watching Hot Springs Village Venues.
In this episode of Village Venues, we interview Mr. Carrol Astin with the SHIPP program and Cyrie Wright from KVRE. Carrol is the representative for the Seniors Health Insurance Information Program in Arkansas, a free service that can give you referrals to other providers and help you compare insurance rates in Arkansas. We join the interview already in progress. So, Cyrie, how are we going to promote this? I mean, we need to get the word out.
We do, and that's why Carrol called me, because I'm the person that can get that done for him.
At KVRE.
At KVRE.
.com.
It's not just me. Yeah, .com. That's right. Streaming live. Anyway, but Carrol called me. We visited for a while in the spring, because we rolled out his first campaign in the spring, just to get some general basic knowledge out there. And we start again November the 4th with the second rollout. And that, of course, is really encouraging people and giving people that knowledge that they need for the open enrollment. The one thing I want to kind of backtrack just a second on,
Sure.
if you don't mind, is to let people know that this costs you nothing. This is an informational environment for you to be able to go to. No question is a dumb question. I think that's
Carrol,
important.
you had said earlier, it's an unbiased service.
Yes, it's free and unbiased. We're only here to give you the information you need to make the best choice,
Right.
for your drug plan.
Which is wonderful. I mean, that's the gist of what you're looking for these days.
And available in every state. I mean, we're obviously in Arkansas, and
Right.
you can see his little logo. It has the state of Arkansas, but definitely it is a federally funded program, and we want to just reiterate that, just to make sure.
So
He's not selling anything.
good.
Just
and
help.
I was saying,
Just
for
help.
all the three of us here, luckily we're not in that group yet. But we mentioned a moment ago, Medicare D stands for drug,
Mm-hmm.
so you can compare all your drug programs, right?
Correct. There are 54 different products under the Part D drug plan sold in Arkansas.
Wow.
And they change every year. The formularies change, companies change, the cost of what particular medication you take changes. And this will afford you the opportunity to evaluate every year at this time what's the best drug plan for you.
And so I would pick one of these drug programs, and each one has a different copay, or each one has a different. For example, if I had a heart issue, maybe one program would favor me more than another.
I guess you would look at it that way. One of the things you have to look at is, and this is what I would tell, I always say, when you sell insurance, how would you sell it to your mother? In my mind, I always viewed this as saying, okay, what is my total cost going to be for the year?
Oh.
I really don't, gather in information about premiums or deductibles, the donut hole. When I plug in all my medications and I compare my drug plans and I take the top three, what are going to be my lowest? What's going to be my lowest bottom line for the year?
Yeah.
And because it can't change.
Oh, well,
It
and I wanted
cannot
to talk,
change.
So explain to me specifically, like I'm slow here, open enrollment means?
It's the simple fact you get to find out what's going to be the best drug plan for you for the next calendar year. You have that drug plan from January 1st through December 31st. At that point, those prices are fixed. There's
Right.
not going to be a change. But we know things do change. So the open enrollment period allows the insurance companies before October 15th to tell us what everything's going to cost, what each individual drug will cost through their company.
So they get before October 15th, they've got all their numbers together, and we're going to be able to provide this drug for this price. And so from October the 15th till when? When's the last time I can?
Through December 7th.
Through December 7th.
I have no idea why they picked that date. It's Pearl Harbor,
Out
but
of
that's
thin
it.
air. Out of thin
Yeah,
air.
there are certain other days in Medicare. They have one requirement that's 63 days.
Really?
Yeah, if you leave your job and you lose your insurance, you've got 63 days to pick up credible insurance.
Yeah.
It's just one of those numbers that just came up.
It was somebody's favorite number.
Yeah, and December 7th is an easy day for some people to remember in Washington.
Exactly. I can guess so, yeah. Kind of like having a bomb dropped on you.
Yeah, exactly. And imagine Carrol has to, it's a continuing education process for him to be able to be as aware that he is for all these different plans.
No,
So
that's correct.
That's
really, really correct. I mean, you have to stay up to date on what's happening. One of the things that you're seeing in the information world now is you're seeing Medicare get out there and try to get at the forefront of what they have. So they actually have a website, Medicare.gov.
Right.
And that is where if you want me to steer you first and you think you've got it made, I'll steer you to Medicare.gov, find my drug plan, and let you go from there.
Well, and let me interrupt just for a sec. Siri, we were talking, there are people that advertise on KVRE that advertise the Medicare D,
Right.
that they offer a program.
Right.
And those are great services, and we're not disparaging those in
No,
any
not
way.
at all. No.
But if you want an overall comparison of all those providers, you go to Medicare.gov, which is promoted by Arkansas SHIPP. Where exactly, is that the only link? I mean, should I go to SHIPP and look, or is there anything just Medicare.gov?
You could go to SHIPP. We're going to connect you back to Medicare.gov.
Okay.
Everything stops and starts with Medicare.gov. If you go to the SHIPP website or the Facebook page, there'll be a link to get you to Medicare.gov. But if you start at Medicare.gov, they have really made it simple to follow.
Okay, and we're obviously going to have it down here at the bottom so you'll know what the address is
Right.
and make it easy to get to SHIPP. But I'm very interested. So roughly from October the 15th to December the 7th, after December 7th, what happens?
You're late and you'll pay a late fee.
Really?
Or you're stuck with the drug plan you had the year before.
Right.
Really? Well, it couldn't be more important.
That's right. So knowledge is power. Get your knowledge.
Well,
you know,
get to
Carol's
make your
available.
decision.
Yeah.
If you have the knowledge, you get to make power.
Yeah. A lot of times we don't have that we don't have the final say.
Yeah.
And this is giving us the opportunity to have the final say in what is best for us.
Wow.
at
Yeah,
this
and
moment.
one thing to add on to that, through our program, we have at least 2 partners in every county that help us promote this program. There are at least 3 down here in Hot Springs that we will use.
Huh.
And a lot of times people will want to talk to somebody they know, somebody that's in their neighborhood.
Sure.
You know, so we're going to refer them back to our partners that are in this area.
Wow.
And when they pick up the phone and either our partner calls, they'll recognize a number, or they'll be dialing, if we give the number out to our partners, they're going to be dialing a local number. It's
So-
not an 800 number. It's not an out-of-state
Right.
number. It is going to be a social agency within Garland County or any other county that we serve.
Who would ever have thought, and I say this to our audience, who would ever have thought that we would have had to come to a point where we have to tell people to quit impersonating the government? I mean, really, it's
Yeah.
to that point.
Yeah.
You know, I got a phone call the other day, this is the IRS. This is the IRS, how can I help you? I'm like, no, I don't think you're the IRS, I'm pretty sure. But my point being here, this is an entity you can trust. It's a local call with agents all over the state that are going to contact you locally.
Agents
let's
that
don't
you're
call
going to
them-
recognize.
Yeah, let's don't call them agents. Call them Medicare counselors.
Medicare
Yeah,
counselors,
there
I'm
you
sorry.
go.
And
Excuse me.
they're going to be with local social agencies.
Agencies.
Right off the top of my head, West Central Arkansas Area Agency on Aging,
Yeah.
Oaklawn Center on Aging are the 2 that come out. We really made a focus to get 2 in every county.
Wow.
So I think we've succeeded in all, with maybe 3 counties up in the Northwest, but that is Northwest Arkansas, and they're a separate state unto
Yeah,
themselves.
they're a bunch of hillbillies up there. Listen, thanks for joining us on Hot Springs Village Venues, and come back next time. I think we're going to have Mr. Carrol and Miss Cyrie again, and we'll talk more about SHIPP.
Thank you for watching Hot Springs Village Venues. Please stay tuned and follow us on Facebook to see the next episode.